All right, so I've been getting some questions regarding the peds review for ENT, so I just wanted to go over those really quickly with you. So the review sheet shows to understand the difference between strabismus and amblyopia. So this is a super easy concept at baseline. So amblyopia indicates that there is a visual abnormality that is causing the alignment of the eye to be off, whereas a strabismus is just a medical term for crossed eyes. So that's kind of the easiest way to distill that. The second viewpoint was regarding repeat audiometry following an otitis media infection. The point is that we don't need to refer these people to audiology because we know the reason why they have a conductive hearing loss, right? They had an infection in the inner ear. It caused conductive hearing loss, and we just need to repeat this test in the next month or so to make sure that there's no sustained hearing loss and that we don't then need to refer them to audiometry. The third review point was to understand the management of mastoiditis and its presentation. Okay, so mastoiditis is going to follow an inner ear infection. They're going to have pain with movement. They're going to have this inflamed, red, hot, swollen area. They're going to be sick as stink. You're going to want to treat these people aggressively. They're going to need to go to the emergency department. They're going to be an admission. They're going to be IV antibiotics, and they're probably going to need to have a CT scan. What is the common sequelae of a URI? Well, we've all had an upper respiratory infection. So upper respiratory infections can progress into what? They can progress into an otitis media. They can progress to a sinusitis. They can progress to pneumonia. So just kind of knowing that, I think the common progression for a URI is a sinusitis or an otitis media. So just something to know there. The treatment and presentation of thrush. So a lot of times the kids will present with poor feeding. Sometimes this is not always the case, but the presentation as far as clinically what we can see is going to be white plaques in the mouth, and maybe some lesions in the mouth as well. And the treatment for that is either the Gentin Violet or the topical nystatin. Let's see what's next. Understand the common presentations of URI. Okay, so a URI in the pediatric population, we need to realize that these kids are probably going to have a fever for a few days, and that fever is going to remit, and then they're going to have other signs and symptoms besides just one, like they'll have a runny nose, nasal congestion, sore throat, maybe a fever for a couple days, things like that. I mean, we've all had an upper respiratory infection, so we should all understand what that means. Also, let's see, how does otitis externa present and how is it treated? Okay, so you've got this kid that was swimming, got water in their ear. That's like the classic history, but there's a whole lot of different histories that we can see. But basically, tenderness to palpation of the pinna or pressure on the tragus. You're going to see that canal is inflamed and irritated. These kids are reluctant to let you look in that canal. Know the presentation of a foreign body in a child, right? So sometimes the child's not going to tell their parent, but their parents can say, oh my God, I don't know. They're pushing on their nose and there's this disgusting discharge and it's foul smelling. That's really kind of the presentation. Sometimes it will be they're tugging at their ear, just based on where the physical location is of that foreign body is going to kind of help you with that. Understand the presentation of scarlet fever versus other diagnoses, right? So scarlet fever is going to follow a strep pharyngitis, right? So you've got this untreated strep pharyngitis, and then over the next little while, the child is now presenting with a sandpaper rash that is equally dispersed throughout the torso, and it is a blanchable rash. So that's kind of the take home there. And then there's a lot of other rashes that can kind of masquerade as scarlet fever. So we want to understand that the classic verbiage for that is the sandpaper rash. Understand what an abnormal tympanometry reading can mean. Okay, so if you've got abnormal movement of the tympanic membrane, right? So you're doing the insufflator, you're making the tympanic membrane move in theory, right? Well, anything in that middle ear can cause that tympanic membrane to not behave appropriately. So it doesn't always have to be an infection. Infection is a cause, but also a serous effusion can be a cause as well. So what I wanted to get home here is that in the absence of any signs of infection, we need to understand that there could just be fluid, a non-suppurative fluid like a serous effusion or an air effusion that's causing abnormal movement. We want to repeat this probably in a month or so, just to make sure that maybe there's not permanent damage or scarring of the TM or something else going on and we need to refer. So if we retest them in a month and everything is moving normally, well, then we can understand that that was just because of some sort of a inflammation, like you know, people with seasonal allergies, they get eustachian tube dysfunction. You know, the eustachian tube is supposed to drain into the throat normally. And so children kind of have a small eustachian tube anyway. So if they get mucus and congestion in there, then it's going to back up and cause the middle ear to not behave normally because there's an effusion. So what I wanted you guys to understand is that it's not always infectious. It can also be just a normal serous effusion that is causing that, and that we should repeat after maybe we add, you know, intracortical nasal spray or a second generation antihistamine and see if that makes a difference. So that's the review. I hope you guys do wonderful. I think if you have a handle on that review sheet and you go back through the lecture at least once and you've done your reading, you will be well prepared and you will rock it. Good luck.